Thank you for joining us here at Doctor's Nutrition. I'm Dr. Jim.
And I'm Dr. Janine.
And if you've looked at your family history, and maybe it was sort of like mine, it wasn't too good as far as the cardiovascular stuff stood out, maybe it's time to kind of look at some of the things that you need to be testing to make sure that you don't wind up like some of the rest of the family that had all that cardiovascular disease.
Right. We're going to be talking about an NMR, a CRP, a homocysteine, a lipoprotein A, an oxidized LDL. These are tests you may not have heard about before, but it's things that you need to see if you have the risk factors. Because if you do, it's time to change it. And there are ways of changing it. Let's start out with the NMR and tell you how it's different to have a lipid panel and have an NMR.
Yeah, a regular lipid panel looks at, basically just kind of calculates cholesterol. Dr. Friedewald come up with it, God, back 50 years ago, I guess, or better. And it's the common everyday test that they do to check your cholesterol, your triglycerides, and so on. And it doesn't give you a lot of information, whereas the NMR is a totally different animal.
Yeah, it breaks things down into more parts. It looks at your particles. It looks at your LDL, HDL particles. It does give you your HDL, LDL. It gives you all the information you're used to getting, the triglycerides. It also looks at size. It looks at your LDL size. So do you have a little bitty LDL or do you have a big fluffy LDL? Because it does make a difference what kind you have. One is bad and one is good. So it's like you have to look at all information to see if you are at risk.
And everybody says, well, what's a particle? Particle is how your cholesterol is transported or moved around the body. It's a little protein sac, and inside it, it has cholesterol. It has things like triglycerides. It has other fatty substances that we use for like cell membranes, things like that. All that stuff, just kind of stuffed in there. But it floats around nice and gets to a cell, and it can dock with that cell and give off what it needs. The cell gets what they need, and then they go on about their business. Now, that's what a particle is. But like she said, you can have big fluffy particles or you can have small dense particles. Never going to see that on the regular lipid panel.
No.
Only on something like the NMR. It's a nuclear magnetic resonance. Basically, it's an MRI of your blood. So we can actually see it rather than guess at it. And one of the big factors that I see on NMR, people come in and say, well, they tell me I've got really good HDLs. And I look at, we do the NMR. Yes, they do. They have a nice ratio between LDL and HDL. So they look pretty good. But when we look at those particles, the LDL particles might be off a little bit or something, but we look at the HDL particles as well. And they have a low HDL particle number and not a good functional HDL particle. We have something called a dysfunctional HDL. Not good.
Which means it's not protective.
Right.
So everybody thinks if they have a high HDL that it's always going to be protective, and that's not really the case. If you do have that low HDL particles, even if your HDL is high, your HDLs are really not that protective, and that's what you want them for. So another thing that is on the NMR, it takes all this information. It takes the information, all these different numbers, and it gives you an insulin resistance score. So insulin resistance is basically before prediabetes, which does play a huge role in cardiac disease. They know that diabetics are way more prevalent on getting cardiac disease. And so you do want to know if you have a high insulin resistance score, and it will show up in that area a lot of times before it'll show up on an A1C or even an insulin. So you definitely want the NMR, because it does break things down better and it gives you way more information on whether you have good cholesterol or bad cholesterol. And not all cholesterol is bad. So the next test we're going to talk about is an hs-CRP, which is a highly specific to cardiac CRP, which is a C-reactive protein. It is a protein that is an inflammation marker. And it looks for, if you have high amounts of the CRP in the arteries, then it knows you have an inflammatory response going on. And what that means is you're at risk for heart attack or stroke. So a CRP, I believe, is a really important test to know where you are to see if you're at risk at this time. Doesn't mean you're never going to be at risk if it's low, but it means you want to know at this minute, are you at risk?
Yeah, what's amazing is the number of people we see with an elevated CRP that have no idea, because you can ask them, is your knee bothering you? Is your elbow? Is there some other musculoskeletal problem that's causing inflammation? No, I'm fine. Okay, well, with an elevated CRP and everything else is fine, we got to really be suspicious of this heart thing.
So another test and it is definitely genetics, is something called a homocysteine. And homocysteine is way worse than cholesterol ever thought about being. I always say it'll block an artery way quicker than the bad cholesterol. So it is one that you really need to know where you are. Now, I have seen people's elevated as young as 15 years old. Homocysteine is a byproduct of metabolism. That's what everybody always says. What's homocysteine? Well, it's something the body produces, and it actually produces more when you exercise. Not to say don't exercise. It just means if you're one of those that can't reduce it, you need to do something about it. So homocysteine is then turned into methionine. And methionine doesn't cause any problems. But some people don't have the ability to turn the homocysteine into the methionine, which is where the problem begins. And when homocysteine is like a little rocket-chaw in the artery, so it will prick up the arteries and cause damage, and the body has to lay down plaque in order to help it. Another bad thing about homocysteine, it will also harden arteries in the brain, which will increase the risk of dementia. So homocysteine is a big risk for dementia and heart disease. A lot of things that are risk factors for heart disease are also factors for dementia. They kind of go hand in hand. And I'll let Dr. Jim tell you about lipoprotein A.
Well, the Lp(a) is a genetic test. So you're born with this Lp(a). And it is a certain lipoprotein, or back to the little particle stuff. It's attached to those particles. And it can cause a lot of problems, in the body. It can cause a lot of inflammation, and it can also cause a lot of damage to cells when it gets in those cells. So it's something that we want to be aware of. Now, it being genetic, you're going to have to do something in the epigenetic range to actually change it. And there are ways to change it. I've actually had people come in and say that, oh, I've been told you can't change the Lp(a). Well, we really can't reduce it drastically, that's for sure, because it is genetic. But we can do a lot of things epigenetically to protect ourselves. Certain amino acids block it from actually doing its bad job. So there's things we can do. We just have to know we have it. And the first step, do the test, find out what your Lp(a) is.
Yep. Now, another test that's really important if you have cardiovascular risk is oxidized LDL. So we talked about the LDL that you get on the NMR, but this is looking at a totally different test. It is, you can have normal cholesterol and actually have high oxidized LDL. And half of all people that have heart attacks have normal cholesterol. So cholesterol alone is not the problem. So you look at oxidation. Now, oxidation is actually something that we can all get at times. Now, this tests how much of your LDL is oxidized. When they do studies on cadavers, which are people after they've died, they actually see that all the plaque in the arteries are oxidized. All the cholesterol that is in that plaque is oxidized. So oxidation is one of the worst things you can have happen to your cholesterol. So this will tell us, how bad is it? Totally different things lower oxidized LDL that lower cholesterol, because things that lower cholesterol don't change the oxidation. So it is something very specific, but we definitely have things that change it. So it is another good number to know, because if you know you have it, there's things that you can do about it.
Very true. It's worth knowing. If you've got a high oxidized LDL and you know about it, you can do something about it.
Yeah. Another test that is good to know is something called fibrinogen. You don't really see it done very often, but fibrinogen is a precursor to fibrin. Fibrin can hold together clots and plaques. So when you get this really high number, fibrinogen, you know that you are probably more likely to form a clot or plaque. So again, we check fibrinogen, and then you can see if you need to do something for that. Lab work is for information, because if you have the information and the knowledge that is what's going on in you, you can do what it takes for you individually to actually help your cardiac disease. Not everybody has the same factors. You have some people have every one of them, and you have some people just have one of them, and you have some people have 2 or 3 of them. You don't know. So you don't want to have to take things to help every different area when you don't know if it's part of the problem. So that's why it's important to do testing and to see what is factors in your cardiovascular disease. Now, there's all other tests that we definitely say coincide, and you got to know. And, thyroid is so important in controlling some of your bad cholesterol. That is so important. Stress hormone, everybody knows that can actually increase cardiac risk. Diabetes, I've already mentioned, can definitely increase your risk factors. So all those tests together need to be done so you can see where you are, so you can personalize your health plan.
Yeah, because that's what it's all about, really, is personalizing your health care. Not something for Joe Blow down the street, something for you, specifically for you. Whatever you got going on, you need a very specific game plan.
Yep, that's what we've done for years. We definitely have some panels that have all these tests together. We have our super cardiac panel that has every single one I've talked about. We have our expanded cardiac panel with an NMR that has most of it, and then we can add the oxidized LDL and lipoprotein A. We can always add hormones to the panel because some people really like to know where their hormones are. So there's different panels that you can have different things checked. That's where we come in. You can call us, give us your personal background, your concerns, and where you are, and we can come up with the best test for you.
That's the key, is the best test for you.
Right, because everybody is a little different. There may be something else we need to add a little bit of if there is another issue on top of the cardiovascular disease that you're worried about. That's what we're here for. You can give us a call. We can look at you personally and maybe devise a test specifically for you.
So be sure and on our website and I think in our Facebook, especially with our Facebook and so on, you can actually fill out a little thing for a consult. And we'll be glad to call you. We'll contact
Actually, it's on our website.
It's on our website.
It's on our website. You fill out a consult sheet and you tell what your concerns are. You tell age, things like that. So we'll know kind of how old you are. And we will call you back personally. One of the doctors, there's 3 of us there. One of us will call you back and we will go through what you need and we will see if our lab work that we do is eligible in your state. So just give us a call and we can go from there. And always make sure you like us below and actually write a comment and we will get back to you there as well.
We sure will. We always answer our comments. So thank you again for watching today. I hope you have a great day and let's keep you healthy.